look to Dr. Kim to answer this question. From your experience in partnerships for capacity building, sir, with primary care physicians, and also the partnerships of the Arvind Eye healthcare system with the public health system in the diabetic retinopathy project in India, can you please highlight opportunities and challenges for ophthalmologists for effective partnerships with diabetic care providers in diabetic blindness prevention? Dr. Kim.
Thank you, Dr. Nikat. Good morning, everybody. Dr. Murthy and Dr. Padma brought out a wonderful scenario of what is happening in the country today. At Arvind, we have been doing this diabetic retinopathy screening at the diabetologist's office for the last 25 years now. But I can tell you the challenges of the physicians getting to use this. We have put the fundus cameras, not ask them to buy, put the fundus cameras, ask them to charge the patient that they can, and then send the images to us, and then we would see. The footfalls, if you keep monitoring, it literally has to be a monitoring, like we have to keep pushing them and then say why all the patients are not. So that we have been doing, and then the recent times for the after the COVID, the AI has taken over, and then there has been a dramatic increase in the number of patients being screened for two different reasons. One, earlier it used to take time for the doctor to grade it and send it, so it's about an hour or two before they would get it, and it was not available 24/7. Today it is available 24/7. They could do it, and then within a minute they get a report. So that has really made a big change, and then our number of screening went up by 8 times. But saying that, we still are not able to convince the physicians to the extent that it is something that is a very big value addition for their patients when you do the eye screening. Dr. Padma was showing, you have a blood test done in their office, and we are saying this is one more test you're doing in your office, and you're saving a visit to the ophthalmologist's office if you do that for your patient. And that some people have taken up, but very few are convinced. So recently at VRSI, being the president of the VRSI, I've been able to talk to the RSSDI, the largest diabetologist association. Myself and Dr. Manisha Agarwal have been working hard on this, and recently got them to take over, and they've agreed, and they are now talking to their members to take up this. And we have also published a paper last year, a physician statement jointly, on how the DR screening guidelines for the physicians. So this includes the tele-screening and what all they should do. So that has still been a challenge. And recently now we are also launching from VRSA with the RSSDA a program called Drishti. Exactly what it is to create a model of identifying a diabetologist in each zone of the country, and then partnering him with the local ophthalmologist, give them a fundus camera, train them, and then use that as a model so that this will go to different zones, and people at RSSDI will take it up. Remedio and Sun Pharma are partnering on that. So these activities are happening, but saying that it is not easy to convince the physicians or the diabetologists to take up. So I've been talking in every meeting that the onus, what Dr. Murthy pointed out, the onus of finding diabetic retinopathy is not with the ophthalmologist, and it is with the physicians. Recently, last December 2024, we finished screening 1 million eyes for diabetic retinopathy after deploying the AI tool. And it was surprising. We had deployed it in all our vision centers, the primary eye care centers, and many of the diabetic clinics. What we distinctly found was the number of diabetic retinopathy identified was 3 times higher in the diabetology clinics, and the advanced diabetic retinopathy patients were found in the diabetic clinics or the endocrinologist clinics, and not in the vision centers. So it's very clear that the focus should be that the physicians should take it up, primary health centers can take it up. We have one model in Theni, Dr. Nam had put up in district of Theni, where the PHCs, usually the diabetic patients go to collect their medicines, diabetic medicines on weekly once on a Tuesday. On those Tuesdays, our vehicle, screening vehicle would go there, and the local physician would not give the medicine unless the patient has had their screening. Within the last 6 to 1 month, the 1 year, they should have had at least one screening. So that has helped to, but again, that is not, we are not being able to scale it up to other PHCs. So there are quite a few challenges, or we need to convince our physician colleagues to take it up.
So I think we need to take up advocacy with physicians and endocrinologists as one of our policies, or even in their societies, and again in our own closed groups. And I think, yes, they need to see the value addition, because yes, finally that is the final solution. And thank you so much.